Thank you, Dr. Surisaidia and sir. Good evening, good afternoon, and good morning. This is the 1894th day of continuous webinar conducted by International Forum for Preventive Homeopathy. Today, our guest is Dr. VIREN NIMBARK MD. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have the local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathy student or doctor or a homeopathic lover. The purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is Dr. VIREN Nimbarak. Doctor is an associate professor, Department of Surgery, Rajkot Homeopathic Medical College, Gujarat. He is a consultant physician at Homeopathy Clinic, Raya Road, Rajkot. He has more than 15 years of clinical experience and 9 years of teaching experience. He is a person who is a resource person in webinar series by International Ifph Spontaneous in January 22nd. And he has presented an abstract presentation in NobCon 2021, Nobel University, Jaipur, Gujarat. And Doctor has presented some papers before also in this forum. And today we'll be talking about understanding all autoimmune disorders, the homeopathic perspective. As we all know that homeopathy can do a lot of wonders in the so-called autoimmune diseases. Let us see what Dr. VIREN NIMBARK has to say about all these things. Yes, Doctor, you are welcome to the session.
Thank you, sir. Thank you very much, sir. Good evening to all. For today, as I had taken this topic that is on the particularly autoimmune diseases. As we all know that one of the scope of homeopathy is an autoimmune diseases. There are different particular diseases. As such, it is also affecting from head to toe almost all the type of the organs, almost all the systems. It is also having the effect on each and everywhere. So we will try to learn as much as I will also learn that what is the particular scope as well as in future what could be the more beneficial for the homeopathy. Okay, so I will just start my presentation.
Yes, it is visible and everything fine. You can go ahead.
Yes, so the particular topic that is the autoimmune disorder is well known that it is having one of the particular scope inside our system of medicine, as I don't particularly discuss about another different systems, but in cases of autoimmune disorders, the different systems are affecting that the conditions are arising from any such particular part of the body. First, we will just have a glimpses about the immunity, that the immune system of the body is comprising along with the different two types. There are particularly two types of the immune system. First, that is the innate immune system, that is from the particularly from the mother to the child, and second, that is acquired immune system. So in cases of the innate immune system, the T cells plays a very important role. Those are particularly generated from the thymus, and thymus becomes rudimentary after the birth, and over the acquired immunity that is majorly developing from the adulthood, and it will long lasting for the any human being. So in cases of the acquired immunity, it is majorly along with the immunoglobulins, that is IgG, IgA, IgM, IgD and IgG again. Okay, so this immunoglobulins are developing the immune system, and those are having the different originating from the bone marrow or the adenoids, or those are also stored over the spleen. Those are also developed, as I had just said, from the thymus. And these immunoglobulins as well as the different WBCs, those are the white blood cells that is circulating through the blood. And in the cases of the circulating through the blood, those WBCs are developing the immunity for the human beings. Those WBCs are also having the different types. We just don't discuss in detail about that B lymphocyte, T lymphocyte, all those are also developing the immune system for the human being. As well as the mast cells plays a very important role that we will also discuss further on in the one particular type of the disease of the autoimmune disorders. So the autoimmune disorders are the group of the diseases which are involving over the particular different organs or the system of the human body. Okay. These disorders can impact various organs and systems, resulting in a diverse spectrum of the symptoms. By examining these conditions through a homeopathic lens, we can uncover the potential of the holistic treatment. Now, these all are the different systems and organs. In cases, 1 minute. Okay. So the autoimmune disease can cause a wide range of symptoms, as we had discussed. So particularly whenever the one immunological disorder will develop, it will again affecting target system that could also spread from one system to the another. Okay, so whenever the target system is affected, it is forming the sign and symptoms of that system or the organ first primarily, then later on it could also involve the different other systems as well as the organs. The first example that is here, it is also shown in the picture that the joints, muscles, skin, blood vessels, digestive system, respiratory system, nervous system, almost each and everything is getting affected. The example is the major example is the rheumatoid arthritis. As we know that the Rh factor is a one particular factor that isn't present in each and every, that is present in each and every person, but not every individual is responsive for that Rh factor. It is only responsive for that a few person for that particular Rh factor, and because of that the rheumatoid arthritis is developed along with the joints as well as the muscle. As we know that the arthritis is developed from the majorly around 40 years of age, and that 4th to 5th decade arthritis will be also developed along with, it is also getting particularized in either rheumatoid arthritis or osteoarthritis. So in such diseases, autoimmune, the immune system is destroying the body, the self destruction occurs in such a cases. So in with the same example, that is Ra, in cases of rheumatoid arthritis, the muscle pain, muscular weakness, joint pain, swelling, stiffness, particularly in the morning stiffness is also very much affected in the patient. Another example, that is type 1 diabetes. Okay, in cases there is hyperglycemia, and again it is also affecting over the vision, over the retina. It is also the affecting over the neonate pediatrics. So all such autoimmune diseases are affecting again and again for that one particular patient. They are majorly in the chronic in nature. They are also having the episodic attack, and in such a cases, the whenever the episodic attack is begin, it is required to have the symptomatic relief first. So what happens in the allied science, they are taking the majorly for that particular episodic attack only, and the symptomatic treatment is given, the patient will go and come again. So that is also very much harmful for the patient as well, as well as financial, the psychological effect is also affecting for the chronicity. So thus it is also causing the very much harm for the patient. Now many autoimmune diseases are causing the inflammation, that is the basic immunological response. We all know about the inflammation, that is the basic immunological response which is in the circulating blood, and majorly it is also affected along with the cytokines. That is also one type of the protein that is present in the circulating blood, and whenever there is any bacteria, virus, toxins which are secreted also from the bacteria or virus, or any pollens, pollutions, pollutant which have entered inside the circulation, the cytokines will affecting over those particular pollutant, and then further on it is developing the inflammatory responses in the physiological way. But whenever there is any abnormality, if it is also more increased in such a way, it is producing the chronic inflammatory condition, or there are also some trigger like factors, triggering factors for this autoimmune response in each and every disease, majorly the wet weather, pollens, pollutant, warm weather, again there is severe change over the temperature. All those conditions are also the triggering factor for the autoimmune disorders, and that is causing again more and more episodic attack for that particular disease. We are not going in the diseases till now, but we are this all are the general aspect of the autoimmune disorders. They are majorly causing the sensation of warmth or heat. All are the signs of the inflammation, that is the warmth, discoloration, swelling and pain. So that is the basic thing which occurs in the cases of autoimmune disorders. Lots of autoimmune disorders cause symptoms that come and go and reoccur. These episodes of more noticeable or more severe symptoms are called flares or attacks. So further on, by definition, autoimmune disorders occurs when the immune system fails to distinguish between the self and non-self, or the foreign particulars, that is leading to the tissue damage. The tissues, self cells are getting destroyed by the immunoglobulins, or as we had said, that is WBCs, and then further on it is causing the destruction of the particular type of the cells, or it will also lead to affecting more and more other types of the cells. There are more than 80 known types of the autoimmune disorders, which are including RA, leukoderma, urticaria, lupus, systemic lupus erythematosus. All those are affecting over the different particular parts of the rather than uh, different particular parts of the body. Okay, it is also affecting over the joints, muscles, skins. In the cases of joints and muscles, the rheumatoid arthritis, lupus, myositis. Over the skin, there are also the vesiculitis. Urticarial vesiculitis is also different. That is the major disease that we will discuss for the today's webinar. That what I think, because the particular other diseases, that is also including the psoriasis, systemic lupus erythematosus, leukoderma, all are many times aware for the patient, that the patients are also aware about them, that the homeopathy have something for them. But the many other disease condition like the rheumatoid arthritis or urticaria, that is not that much believable for the patient even, that it is getting curable. Because many times what happens, they have the attack, they will take the pill, and then it will be subside. Many times it is also that much suppressed that it is arising the another disease, and because of the other disease, that particular autoimmune disorder is getting dissolved. So in such cases, very manageable homeopathically, and the recovered cases that we will also discuss. Okay. So the first thing, that is rheumatoid arthritis. It is affecting over the overall the body, but the major few parts of the body that is affected from the RH factor, particularly RH titer, as we all know, that is the investigation we will also discuss. But first, the clinical features is included along with the eye condition, that is causing the dryness of the eye, dry mouth. The patient is also feeling fatigue. There is also very much weakness. It is also affecting over the lungs and producing the scarring or producing the nodules like the tuberculosis. Okay, it may also affect over the valves of the heart and producing the particularly stiffness of the valves. It is also affecting over the digestive system. Esophagus is also getting stiffened. There is also affection over the cartilages that is getting damaged. In cases of rheumatoid arthritis, the inflammation over the hand, inflammation over the knees, ankles, feet, toes, all those are the particular major complaint, and there are episodic attack majorly over each and every morning. There is repeated attack of the stiffness that the patient could not getting locomotor action, that could not move immediately after awakening. That is majorly known as morning stiffness in the cases of rheumatoid arthritis. Patient is also having the fatigue. It is majorly getting diagnosed along with the blood test like the RH titer majorly in the other person. If the person is healthy, it isn't giving the major kind of the RH titer, but whenever the patient is having the high RH titer, it is the type of the particular immune antibody which is prepared along with that particular antigen that is developed inside the blood and in circulating blood, that is also spreading throughout the whole body. Okay, there are also the chances to diagnose it along with the MRI scans. Whichever joint is affected, the MRI will also show the synovitis, that is the capsule is getting fragile, that the capsule is affected first and then later on it is also affecting over the muscles. There is also breathlessness, it could also causing the fatal condition. Okay. Now the second disease that is the major disease that we will discuss today, that is urticaria. Okay, I just don't know what urticaria is known in the other languages, but in Gujarati we all know it as a silas. Okay, Gujarati માં એને silas કહેવાય. Okay, urticaria globally also known as hives, the well-like structure, well-like vasculitis that is developed all over the body or the particular part in the cases of urticaria. Majorly it is also developed over the part which are having the weight over that particular portion. So if the patient is having the sedentary life, that the majorly it is over the inner aspect of the thigh, it could be also over the gluteal region, buttocks. It could be even majorly whenever the patient is lying down in night, then the urticarial episode will develop over the back. It could also over the back of the forearm as well as the arm. It is majorly developed over the forearm as well as just behind the ear. Those are majorly the parts over which the urticarial eruptions is developed. By pathogenesis, urticaria is developed with the particularly responsiveness over the mast cells. As we all know that the mast cells are in the circulation, that is also a type of the WBCs, or we could say that reticular endothelial cells. Okay, in cases of the patient suffering from the urticaria, these mast cells plays an important role, and that is secreting the histamine. The histamine is also one of the triggering factor for the inflammation. If the histamine is involved is in the circulation, it is developing the inflammation, and whenever the mast cell are triggered from any factor in the patient, like the sour food and drink is also the major condition for the urticaria. Such condition is further on more and more repeatedly, and that is many a times more and more getting rather than concentrated in the patient. So they are developing the more high grade symptoms after repeated attacks of the urticaria, and it will also causing the chronic autoimmune urticarial vasculitis. In simple vasculitis, again the vasculitis is also getting triggered with the autoimmune disorder. In the autoimmune response, if the vasculitis is developed, the particular vesicles are only inflamed. Again the same thing, that is mast cells and the histamine is causing the vasculitis, but in the vesiculitis only there are small, as these are seen in this picture. Okay, those are the vasculitis, not the urticarial vasculitis. But whenever the same is also having the burning, itching, and that is developing like the edematous condition, in such a cases, that is the urticarial vasculitis, okay, with the raised hives and inflammation, it is triggered by the allergens, stress, infection, or autoimmune responses. Okay. So we will just directly go to the few cases of the urticaria. This is one of the case in which the patient will take whenever there is required of the headache. Okay, patient is many a times suffering from the headache, suffering from the weakness, malaise. She had came along with her husband, and in 2024, the few cases are from the 2024, and later on there are also the continuous different other cases that we will also discuss. In this case, she had came with her husband, and she had the urticarial episode. She had also taken the injectable, that is intravenous injectable evil, from the other allied sciences. Okay, so she had taken that injection, she had just suppressed the urticarial eruptions with that injectable intravenous medicine, and then further on again after 7 days she had this particular type of the urticaria eruptions hives, and she came to the clinic. In such a condition, it is first thing that required to give the immediate relief to the patient for the faith of homeopathy. Then further on, it is majorly for the chronicity of the urticaria to take the full case taking, and then further on the uh, constitutional remedy is selected and given to that patient. So the same I had done. The thing which is majorly I am doing in the acute cases, that particularly at a time the therapeutic is more and more beneficial to subside the thing. Okay, and then later on after second follow-up, the patient is also getting more and more communicable, and then further on with the full case taking, the constitutional remedy is given to, if there is requirement, the intermittent remedy is also given, and then the patient could be recovered with the help of this. So she had came in major, I think that is over the December, yes. So it is around 13th December I had taken this picture, and then later on, this is after 2 months. Okay, so in between I have given that on the basis of the case taking, first I have given immediately Apis mellifica, that is the therapeutically known for the urticaria. I have just given Apis mellifica in 3 to 4 cases. So those cases I am showing in this presentation. Other medicines like the Rustox, which is also in not compatible with the Apis mellifica, Rustox, Arsenical, those are also important and many a times given as a therapeutic. But in this case, Apis mellifica had given, and then later on I have also taken the full case taking. On the basis of full case taking, Calcarea carb 1 m, 3 doses is also given in January end, or almost around 31st January, yes. And then after in February end, or just the beginning over the March, this is taken by this is taken at her home, and it is almost gone. So you could see the change, that even after taking the injectable medicine, she is suffering, she is still showing up the eruptions immediately as soon as the as soon as the effect is subside. So that is majorly the antihistamine. Okay, so majorly the antihistamine medicine is prescribed, and then further on, as soon as the effect is subside, it is having the another episode that is majorly almost more superior to the prior one, and then later on the patient is suffering more and more from that particular disease condition. So here that is urticarial recovered. Okay. In other cases, I don't have the recovered pictures that much, but here it is the another two cases. Here the center one is the video. Central video is a particularly different thing. We will just came this case afterwards. Yes, this is prior to that two cases. So that's why we will also take this case first. I have just misplaced the slide. Okay, this is the another case which also came in 2024. In 2024, he had also came from the transfer of the job. Okay, so he just shift to Rajkot almost in March or April in 2024. Then he had just started suffering from the urticaria, because this weather is quite different from his weather in north. Okay, he is residual from the north, residing in north India. Then after job transfer, he came to Rajkot, and immediately he started just like the urticarial eruption over the forearm. You could see. Okay, these are only the small pictures which had been taken. These all are comparatively more larger hives which have developed over his skin. Okay, and he had also particularly affected over the eye. That is also one of the typical condition in the urticaria. Urticaria could also affect over the eyes, ears, and as well as the heart. Okay, in such a cases, whenever it is affecting over the heart, there are also major chances of the more and more pathological condition. So he is suffering from the urticarial vasculitis along with the affecting over the eye blood vessels as well, ocular blood vessels more. So each and every day, almost each and every day in morning, he is having such a typical swollen eye. Okay, and before going to job with this swollen eye, each and everyone is also asking him that, oh, what happened to him. Okay, so majorly in prior, that is in before the transfer, there are a few episodes of this swollen eye at her home, at his home. But after transfer of his job, he is majorly having the recurrent attack of such a typical edematous eye. So here it isn't that puffy bag-like swelling which is described in Calicarb or Apis mellifica or Natrum muriaticum. It is typical urticarial vasculitis which is developed because of the triggering of his immune system. And because of that, there are also all the symptoms which are together. Here it is also the example of the prescription that I have taken from him. This is the prescription what he had got from another allied science, that is histafree. You could also see the first medicine, that is histafree. So what is histafree? It is just giving the patient to get histamine free. So he will get the histamine free for few days, again the swelling subside, and then again the swelling came and more dangerous swelling will come. So here you could also see that prior there are also swelling, but it is comparatively small. After taking medicine, he had subsided that swelling for some days, but later on the swelling is more. So he came with this. He had this photo, upper photo, but the lower one is more recent at that time in September or October almost. Okay, and at that time he had also given the particular history that whenever he is getting wet in rain, it is also getting more and more suffering. Okay, so I again thought first that the Rostovs could be more beneficial, but apart from that, on the belief of the therapeutic that the EPIs should be given, and because of that, I have given the EPIs, and along with the EPIs, that is also getting recovered, that he had not even required the constitutional remedy because he is not suffering from anything else, and only on the basis of the EPIs. And there are also a few intermittent doses of sulfur 200 that I have given to him, and he had recovered. He had again transferred to the another South India, almost in the, I just don't remember the city he had given to me, but in Kerala, I think he had shifted. Okay. So this is one of his case that is very much enlightening us that what happened whenever the patient is taking for longer, he is suffering more and more from the autoimmune disorder, and then later on we are also suffering for the curative perspective of that particular patient, but he is cured again and he is also healthy and free. Here the both pictures on the sideways are the different patient. That patient is suffering very minute attack of the urticaria, but he had also suffering from the same over this particular portion only. That is, urticaria again and again occurred over only to the left upper limb, over the left elbow, as well as nearby to the thumb, left thumb. This is the case which came earlier this year in the January, and he is majorly suffering from the urticarial eruption whenever he eat buttermilk. Majorly in the Gujarat, buttermilk, chas kehvaye એને. Buttermilk is traditional, so each and everyone is eating buttermilk daily over the night majorly. So because of the sour buttermilk, he is suffering from the urticarial eruption each and every time. And again, the same thing, that is, APIS is given to him, and over only within the 15 to 20 days, he had recovered from this urticaria eruption. He had taken the cetirizine prior. Whenever the urticaria occurs, he will just take half cetirizine. So because of that, sedation occurs, and he could not do his job on the next day. But after taking the medicine, he is also very well. And the central video, that is one of the current case. So I will just play the video. This is a case of a girl, child, age around 14 to 15. She had just came in the previous month. Okay, she is also currently under treatment, but proving very well. This video is taken by his parent. His father had sent this video, and for that particular portion, that is the arm, right upper limb as well as the right lower limb is suffering from her. Okay, nowadays there are also few episodes just before 3 to 4 days. There is also one episode for her, but it is comparatively milder. This is the prior. In the previous month, she is suffering from such type of the urticarial vasculitis. So she had also given again anti-allergen. So allergic treatment is a quite different thing. Again, the allergy is also a one type of the autoimmune disorder, but she is not suffering from any kind of the allergy, even though the super specialist has given her with the anti-allergen drugs for almost a month. And after even after her taking 1 month of that particular medication, she had not recovered at any time. Okay, because it is completely irrelevant. So at the time of case taking, she is not suffering from any kind of the eruption. That's why I had asked her father that please send me photos or the video whenever she had any episodic attack in the previous month. And because of that, her father had just sent me this video. So I will also try to receive the before after video of the girl, and then we will also discuss in the next webinar. Okay, now the third disease condition, that is leukoderma, or it is also known as vitiligo. In cases of leukoderma, the patient is suffering from the whitening of the skin. It also refers to the skin depigmentation, or the pigment of the skin, that is melanin. The melanin are deficient, and because of that, it is resulted with the light patches. It is also many a times getting confused with the leprosy, as we all know that leprosy is now totally eradicated. Raktapit does not occur anywhere in the India. But in the past history, because of that idea in the mind, even today's generation is also having that particular mislead. They are also getting confused, the leukoderma or vitiligo along with the leprosy. That isn't totally thing. Okay, and symptoms that it can manifest as white or light colored area on the skin only. That is only the sign which is present. But majorly the cause is again the autoimmune condition or the skin damage that will lead to the leukoderma. Conventional treatment for the autoimmune disorder, that is the pharmacological approaches, it involves the immunosuppressive medication if it is given along with the conventional method. Lifestyle modification, that patients are advised to adopt a balanced diet. Majorly in the cases of the autoimmune disorder, they should not take the spicy food. It is completely prohibited. That the diet should be maintained to recover. easily recover, and also it will be more beneficial for the treatment. Complementary therapies, the patient is also could undergoes with the acupuncture, massage, or also the supplementary elevating like yoga, pranayam, that will also benefit the immune system of the body. They must have the proper sleep. If the sleep is disturbed, the immune system will be disturbed. Homeopathy is also having the very much natural cure, also having the very much healing power. They have the we have the particular different things like the different cardinal principles that is approachable to the autoimmune disorder as well as. Now the common homeopathic medicine, that is the arsenic alb, rustox, calcarea carb, uh, and Apis mellifica. Those are majorly indicated. In the cases of arsenic alb and Apis mellifica, there is particular aggravation from the warmth, but the difference in the arsenic alb, that is aggravation from the warmth, it will be ameliorated by the warmth as well. So patient could cover. And if the covering ameliorates, arsenic alb is majorly benefited for such a condition. There are also the vasculitis which have been treated very well in the other diseases with arsenic alb for my perspective. And in such a cases, the patient is having typical generality of the arsenic alb. They have the thirst, there is also the thirstless, that is frequent thirst. They have also particularly amelioration by the warmth, and in cases of the Apis mellifica, they do not cover at all. They have immediate aggravation whenever they have the covering. So that is the major difference between arsenic and Apis mellifica. In cases of rustox, that is again the major generality. Whenever there is wet weather, if the patient is getting aggravated, must remember about the rustox. If there is getting fit wet or the patient is having the river bathing, in such a cases the rustox will also having very much immediate effect over the patient. In the cases of rheumatoid arthritis, as we know that it is having that diathesis and it is the major beneficial along with the cases of RA. In cases of calcarea carb, the patient is also having the typical condition of the arthritis, but they do not do anything. Weakness, malaise is very much conventional in the cases of the calcarea carb. So those are the few. Nowadays, there are also the other major medicines like the histaminum, also very much well indicated in such a autoimmune disorder. There are also the major cases of sepia in the psoriasis. We will also discuss if the chance is there. In the cases of psoriasis, there is a major role of the homeopathy and it is discussed a lot. So that's why I have just totally omitted psoriasis. We do not need to know more about the psoriasis because there are also major chances, no doubt about the major chances of the research in the psoriasis for more and more development. But the way for such diseases like urticaria, which is not that much getting complicated, but there are also the major scope in such a autoimmune disorder. There should be also the collaborative approach, that we do not just opposite any other science, that is the medical science, but whenever there is a requirement, it should be also communicated to the patient, that they should also communicate along with the other required science as well. Regulation or the monitoring progress is also very much required for the autoimmune disorder, that it is regularly monitored, that whenever the symptoms are getting worse, there are very less observing patient which came, and because of that there are also very few positive very few sign and symptoms, or we could also consider as a positive symptoms. In such a patient, it is required with the therapeutic, and patient should be also guided that the observation is required. After observation, if you find more and more thing, that please communicate to us. So regular monitoring of the symptoms and overall health is essential when combining homeopathy with conventional treatment. Patient should be educated somewhat. I don't just suggest that tell them all the things, that what is histamine and what is mast cell, what is IgA. There are also two types of the urticaria, that is basing on the mast cell only, mast cell reaction IgE deviated, that only the IgE reaction is there, but those education is not required, but they need to know that how this urticaria or sedus is occurring to them. Okay, understanding how to manage the expectation. Okay, so that is required for the patient. Future perspective in autoimmune care. That, as we all know, that holistic healthcare is very much approachable. It is almost always required for the patient to have this such a type of the holistic approach, that patient is majorly getting very much relieved if we only hear to them. Okay, because many a times what happens in the autoimmune disorders, majorly the steroids are also given, other system of the medicine, and they do not need to ask more from the patient. So the patient will just go, tell the name of the disease and come out with the medicine. Okay, so we do not approach like that. We need to hear completely with the integrating dietary, lifestyle, psychological and alternating therapies that will be improved for the patient's outcome, that will improve to cure the patient. Advancement in the personalized medicine, gene therapy, and the new pharmacological agents are also revolutionizing the treatment. Nowadays, there is also the different genetic therapy which is researched. Okay, so which genes are also required, which genes are also responsible for the autoimmune response, that is also getting under research, and that will also give out very much more resolution. Okay, patient centric solutions are also required, that the individual needs can enhance the quality of life and empower the patient. So whenever we just tell the patient along with the different kind of the things, that this all the different aspects that you need to have the approach. Okay, and then later on, if the patient will came, they will also very much happy. Okay, so these all are the perspective of the autoimmune diseases. Okay, so I will just stop my presentation for any kind of the discussion. Yes, hello. So is there any question? We could also have further on, if there are different other cases from anyone of you, if anyone else is also having any particular case of any autoimmune disorder. I think majorly each and every homeopath have almost faced one case of autoimmune disorder in their life, majorly. That much scope is there in the homeopathy. Yes, sir.
Yes, Dr. VIREN
So
NIMBARK.
as you know that I am always having this 5 to 10 minutes free time. That is also beneficial for me. It isn't like that I will just come and speak for the whole hour.
Yes,
Because
it was really an excellent session. You really
okay,
covered all aspects of the autoimmune diseases, and your cases were really exemplary,
yes,
brilliant
yes,
also. We, as homeopaths, may find it very difficult in the early days. What is autoimmune disease? How it comes, how it develops, and all those things were there in our day-to-day practice in the early part. But even though, without knowing that, we were treating patients who were coming into us, and we got result. But only in the later part of our career, only then we identified, oh, these are the so-called autoimmune diseases, and these are the so-called lifestyle diseases. Like that, there was no such classification in the early days. Simply we were treating the whatever maybe the disease that comes into our come in front of us. But things are entirely different. The classifications are different. The methodology is different. But frankly, most of the autoimmune diseases develop due to the overdoses of some of the medications that we have seen. But unfortunately, those people were not telling in that way. They used to say it is because of the problem in the body they are developing. But actually, there is a factor behind that, but that factor is hidden.
yes, sir,
And
yes, sir.
I have seen.
Majorly, that's why they are just that symboling as idiopathic. That is
Yes,
the
yes,
idiopathic cause. They just do not say anything. They do not also even just ask the patient that which are the triggering factor. Majorly, patient will also know. Patient majorly know that which are the triggering factor. Either it is sour food or fermented food or wet weather, anything in the urticaria. In psoriasis also, it is majorly triggered after the anxiety or particular thing, weather change, temperature change. That will also exciting or the triggering, but they do not ask it and they are just giving treatment on their own like that.
I still remember a case of a bullous fungitis that came to me
Yes.
some years back, and the patient was taking nearly 34 tablets in that day.
Oh.
And when after what I found that when I stopped all those medicine one by one, the
Hmm.
improvement was far better, and we got
It
at
is
last we were able to stop almost all medicine except one medicine that he was taking for his heart complaint. All other
yes.
medicine were stopped. Nothing has
It
happened.
is.
The patient life extended for some more, 5 to 8, to 7 to 8 years also.
Beneficial, sir.
That's what homeopathy can do. But unfortunately, the people believe that they have to continue those the so-called medicine given by the respected personalities from the
Yes.
particular fraternity.
The same is also, I have just shown that prescription. That prescription is renowned physician in Rajkot, and he had just given histamine free. So what happens that to him that he will just take histamine free, and after again he had just told me that I have taken 3 to 4 months, but he is not hearing anything. The physician is not hearing from him anything, and each and every time he is giving the same prescription. So it is very much tired for that particular thing.
But the patient believe that, oh, if I stop this medicine, then my problem will aggravate and I may
Ah,
get worsen. But actually, it is not. If the
it is
patient
grave thing.
Yes, yes. What we need is we just whatever be the disease that come to us, we will have to stick on to our principle. We will have to find take the case in detail and
Yes,
find what are the symptoms predominating, what are the common symptoms of the disease, and what are the rare peculiar symptom for the particular patient. And
yes,
that will definitely give you the right medicine. And what are the other most important point is that we will have to find the reason behind the problem. Some people
ah,
believe that the reason may be hidden, but we will have to find why and how it developed. When we
yes,
inquire into the mental state, we can find that, oh, actually in this case, the person, the story I was telling was that
yes,
that particular person was big alcoholic. He was
oh,
addicted to alcohol, and I said once he to take alcohol, then he will show this and that, and even walk without any dress like that. He's not bothered about all those things. He may come back to home and quarrel with his family, and so a lot of problem were there. He was an army person, and as you know,
oh.
both of them were army persons, and they were in different part, and that may be the reason why these things might have happened. And
Sir, currently I am also treating one of the case of psoriasis. In the same case, so in the cases of psoriasis, patient is pediatric. That the girl child around the age of 13. She is suffering from psoriasis till the age of 10 years, and she is also having the skin specialist prescription. Different skin specialist prescription suggesting along with the fungal infection, that they could not even differentiate fungal infection or ringworm along with the psoriasis. They have treated it as a ringworm for 2 years. And then later on, she came to one of the skin specialists over the Ahmedabad, and then he had diagnosed and suggested that you should take homeopathic. And after which, skin specialist is also suggesting that you should take the homeopathic medicine, and then she had started homeopathic medicine for psoriasis. That approach is over nape of neck. There is only the few pages now over the nape of neck. Previously there is current more particular that the psoriatic pages throughout the nape of neck as well as behind the ear, those all are clear. Okay, and then he is continued to the treatment. So all such condition is also faced in the cases of autoimmune disorder. This is also one of the scope. Prior, I have also discussed about the renal calculi. As in Gujarat, renal calculi is also one of the major scope for the homeopathy. The second most is also in the autoimmune disorder. So that's why I have just discussed about autoimmune disorders.
Yes, last time we have a discussion on lithiasis.
Urolithiasis, yes, sir.
Yes,
Yes.
lithiasis. That was the discussion. And
And
anyway,
in my first lecture, there is also, sir, I just don't remember name of him, but he had also given the major different cases over the urolithiasis.
yes, yes, yes. That was a big session also.
Yes,
Yeah.
sure.
Frankly, doctor, what is the attitude of patients there in Gujarat? Whether the number of patients is increasing day by day?
Sure,
In,
sir. There is very much increase in number of the patient, and they are also getting involved along with the homeopathic treatment. As more and more awareness is also, as particularly if speaking for myself, when I was child, there are only few consultant in Rajkot, that is in my native city. And now currently there are majorly homeopaths which could be found along with the homeopathic practice, and they are also practicing honeymoon method. That is that is classical homeopathy. So that is the major benefit of homeopathy, that we are also having the spread over the more and more towards the different people, as well as they are also having approach along with the different conditions, that nowadays it is not only limited to the chronic conditions. Even prior, there is only the one of the beliefs that homeopathy could majorly effective for the chronic conditions only, but now they are also taking the medicines in the acute condition, and they are also benefited. As we all know that if the patient will immediately came in the acute condition also before taking the allopathic medicine, then it will be more and more benefited for the
Definitely,
homeopathic
definitely,
perspective. Yes.
definitely. If
Yes.
we get a patient, even without taking allopathic medicine, we can cure we have seen several such cases of uh,
Yes, sir.
hypothyroidism and all those things. But if they take allopathic medicine for a long time and then they
Then
get
it is.
back to homeopathy, then it would be very difficult to take back
We
the.
need to first take those particular criteria that is developed because of the allopathic treatment, that is also many times like the crossbreed drug, that is
Yes,
also described by Dr. Henneman, master himself. He had also described such disease condition, and
yes.
then later on the clear case is came out, and because of that it will take a long time, and that's why there is also another belief that homeopathy takes long time for the treatment, but it is like that.
Actually, it is not.
It's
Homeopathy
not.
can give permanent cure in the shortest possible time. That's what
Yes,
we
sir.
seen. Yes, Dr. Rambaras, sir, you can speak.
Yes, he had suggested when he in my previous session.
Yes, yes.
Yes, yes. Good evening, sir.
Good evening. Thank you, Dr. Dhanesh ji. Namaskar, Manoj ji, and congratulations, Dr. VIREN NIMBARK.
Yes,
Congratulations. Very nice, excellent session. Autoimmune disease. Autoimmune disease depend family history and past history. Only one suppression due to suppression. Suppression is a very important. Autoimmune disease, arthritis case, leukoderma, या psoriasis. Suppression and external use of medicine and excess use of anti-drugs suffering from autoimmune disease. Autoimmune disease only treatment homeopathy, not allopathic, not antipathy. Only treatment of homeopathy. Psoriasis, long time treatment, long time, and constitutional and classical remedy, and depend past history, past history, family history is the symptom very essential. So very thanks, Dr. Viren Limbark. Thank you.
Now I am inviting Dr. Bob Lim from Malaysia to say auto thanks as well as your comments on this issue.
Thank you very
Yes, sir.
much, Danesh from IFPH India. Hey, I'm Bob Lim from Malaysia, and on behalf of IFPH, I would like to express my sincere thanks and gratitude to the Dr. VIREN NIMBARK for his awesome webinar on the topic of autoimmune diseases by the use of a
Thank you.
homeopathic approach. And I would like to hear from Dr. Viren Nimbam again in the near
Yes, sir.
future. Perhaps he can share some case taking of the autoimmune
Sure.
patient. I hope we can do that in the future with all the
Sir.
evidence and all this with the improvement. I believe that tonight you don't have enough time to share so many things, and I'm sure that you have more things to share with us in the near future. And thank you very much once again, Dr. Vil, on behalf of the International Forum for the Promotion of Homeopathy. And thank you very much. Over to you,
Thank
Dr. Danesh.
Thank you, Dr. Bob Lim.
Thank
Dr.
you, Bowling, Dr. Bowling, the continuous, but a long time is absent in webinar. So very, very thanks. Autoimmune disease treatment intercurrent remedy, miasmatic is a very important.
Yes, sir.
Antipsoric, antipsychotic, and antisyphilitic. Antipsychotic is the important remedy. There are king of antipsychotic remedy, Thuja, king.
Yes.
Puja
King of
calcarea carb. I am majorly also
calcarea.
using medorinum. Yes,
Yes,
sir.
sir. Yes,
That is
sir. We can have some more discussion in the coming presentation.
sure, sir. Okay.
Thank you, Dr. Viren Bar,
Thank you, sir.
and those who
I
attend
am
this.
also try to congratulate IFPH that these are all the sessions. So that is very much helpful for the spread of the awareness about the homeopathy, sir. Many congratulations to the team of IFPH as well. So thank you, sir.
Thank you all. With that, we come to the end of the day 1894. Tomorrow we will have a session from Dr. Maria Salcedo from Bolivia.